All right, I'm not sure either of these are going to be deterred significantly from wherever the individual is at with their knee. Remember, this can also be used at any point in the rehab recovery process. Might also be a good idea to get involved in this with other folks that have dorsiflexion issues, maybe issues with their arch, or again, however you choose to evaluate locomotive biomechanics of the foot. But right now, we're gonna, in theory, attempt to be moving the talus on the navicular. So the first step, none of this is a balance drill, okay? We have a half roller, and there's no value to having it the opposite way. So you can have it the easy way where the flat side is down. Now, what we're going for here, if we're gonna mobilize the left side, I'll try to move these sticks so we get a good view, all right? But now I want, basically, my calcaneus, my rear foot hangs off. Now, I don't think there's a perfect place to put it. Now, use the sticks for balance, whatever you want to use, and your other heel comes directly up against the crease of the talocrural joint, all right? So now I'm trying to balance. There's no value to do this without external support. So first move is to push down with the front side. So I'm putting pressure on the top of my foot. Now my back foot, the one that's hanging off, is going to come up. So I'm effectively creating a posterior glide. Then I'm going to come down with the rear and down with the front, and hopefully facilitate an anterior glide. And then we go back and forth. Rear up, front down. Both down. Relax. Rear up, down. And this is the self-mobilization for the navicular. We just go back up to the table the next time to see what's cooking. Does that have that little bit of glide that probably only is going to live in the therapist's hands? It may not have any carryover to another therapist evaluating it. Remember, we don't know what good is, but we do know what bad is. I don't think when you do this you feel a lot of motion. You might get a little snap, crackle, and pop. That's probably a good thing. Perhaps that's only going to be achieved as you achieve new ranges of motion, and we're talking about micro motion here. We're not talking about anything that has any opportunity to be measured. But I don't think a snap, crackle, and pop is a bad thing at all. All right? You're probably, if we had to justify what we're doing, moving the talus on the superior surface of the navicular. So there's ligaments, there's lots of dense tissue that connects those. Let's make sure it's moving, so when we go back and mobilize the navicular, you see what you got. All right? So next, I'm going to slide the half roller away, and now we're going to get into, I don't want to use the commercial word for this, because I don't know that that's the best word to describe what's happening. I think that really what we're going to try and do is achieve a position that allows for traction and decompression of all of the structures around the navicular bone. And it's going to look like a single leg stance. And yes, it can progress to unsupported, but you can still achieve what you're after with two sticks or holding on to a counter. All right. Now I'm going to use some coins to be able to achieve where I want pressure into the foot. Doing it on the turf, not at all the best option, but that's where we're going to film it. Okay. So if you have these coins that you keep like in the freezer and they're super cold, it is a brilliant tactile cue for what can be odd or esoteric through the foot, because we're looking to manipulate the foot joints to create as much decompression around the navicular as possible. So what is the value there? You take that new environment that becomes very ideally sensitive, and we bring that to our dorsiflexion, we bring that to our locomotion. Now, I'm going to set up these pennies. One is going to be on the cuboid. One is going to be on the first ray, right at the first MTP joint. And the last one is going to be on the medial calcaneus. The coaching cues is to create pressure in that particular triangle. If we were going to mobilize the cuboid or decompress the cuboid, the coins would be different. So it's an entire series of exercise, really where you're trying to create traction and decompression around one structure but not others. Okay, so I'm just going to put these down and we'll stand on it here. Remember, my foot probably not that big. Okay, and I'll wiggle medial calcaneus, cuboid, and I nailed it. All right, so now I'm going to use support. I'm going to get up on one leg. Now, these coins will be freezing, so I would be able to feel what it is that I'm after. Okay, so now here, I'm gonna have it done last, but we're looking at knee extension, relative internal rotation, and a little bit of relative dorsiflexion, almost like you're in a ski jump. Okay, I'm going to save those for last and focus on demonstrating what we're trying to do at the foot. So I want to create pressure through cuboid. I want pressure through the first MTP by pulling the big toe up. If my big toe is up, then I have to be putting pressure at the ball of my toe. And then into the medial calcaneus. So I'm tall, I'm relative internal, I'm relative dorsiflexed, and then I'm bringing 1, cuboid, 2, big toe, 3, and I can't necessarily feel one thing and not another, but now my progression is to stay here and deliver, then perhaps lose the sticks with arms out. And again, cuboid, big toe, medial calcaneus, relative internal rotation, and forward. Next progression would be down, and then next progression would be eyes closed. There is no value for progressing if you still find challenge in one of the others. It's not better if you can't do one of the lower ones. So again, what we're trying to do, if we visualize the anatomy, if you had a pair of hands that was tractioning the first cuneiform inferiorly, and you had the talus pulling superior and lateral, then the navicular will kind of be living on its own little island. Now the inputs to all the structures around the navicular can become a very, very heightened level of sensitivity that our evaluation that I did not show you could have shown that a change in tibial rotation can certainly change how the knee flexes, how the knee rotates, and also what happens down at the ankle. Okay, so you take the therapy that we did in the other video and you would come directly to here and then probably dismiss the therapy at some point where this would be all that you would do to maintain or continue to improve. Now, or we might go back to the therapy to kind of boost, but we would not be using the therapy as a primary source after you get the motion and you've got the exercises to maintain it. So the next video, we'll put it into a training approach. Remember, we chose navicular just to choose one thing that was somewhat requested, like how do you look at the midfoot in terms of ankle dorsiflexion. Clearly, we chose that because of its relation to developing rotary instabilities in the knee. So we'll move on to the next video that's going to show our training approach, and we'll tie it all together there. If anybody's seen a leprechaun, say yeah.